So thank you all so much for joining. On behalf of the University of California Center for Climate Health and Equity and the UC Climate Change and Mental Health Council, we welcome you here today. Our new webinar series on urban wildfires is co-hosted by UCLA's Center for Healthy Climate Solutions, the Jonathan Fielding School of Public Health at UCLA, the Sustainable LA Grand Challenges, the UCSF Alumni Association, and the communications team both at UCSF and at the UC Office of the President. I wanted to take a moment to thank our UCLA colleagues for co-hosting this event and taking the time to disseminate information while they're in the midst of a broad public and mental health crisis. And this is all while they're dealing with their own housing insecurity, health risks, and personal grief over the loss and devastation around them. Please know that your colleagues from across the UC system are here to support you and fill in the gaps where we can for the long recovery process. And we greatly appreciate everything you are doing to keep the LA community safe. I also wanted to thank an amazing team of faculty and staff who put this webinar together in a very short period of time with Herculean efforts, including my CCHE co-director, Ariane Tarani, Alyssa Eppel and Jyoti Mishra, who run the UC Climate Change and Mental Health Council, Dick Jackson, David Eisenman, Mike Jerrett, Jennifer Shear, Claire Brindis, Tarek Ben-Marnia, Neeta Thakur, Robin Cooper, Philippe Golden, Sial Maya, Anne-Marie Charlesworth, and Annie Rosenthal, as well as the UCSF and UC Office of the President communication teams who made this all happen. Now, moving now to the reason for our webinar series, I'm going to briefly provide an update of the LA fires to date. As of this morning, the Eaton fire near Altadena is 95% contained. The Palisades fire is 72% contained. And the recent Hughes fire in Ventura is 14% contained. The Sepulveda fire that started tomorrow is 0% contained. Overall, the LA fires together have burned nearly 50,000 acres, or around 78 square miles, which is an area that is more than 1.5 times larger than the city of San Francisco. More than 16,000 structures have been completely destroyed, many others damaged, and tragically, 28 people have lost their lives. Many others were injured, and over 200,000 people have been ordered to evacuate their homes, with thousands more under evacuation warnings. So clearly, these events are unprecedented in their size, scope, and destruction, and of course, in their health and social sequelae that will become increasingly apparent in the coming days and months. So in this 6-part webinar series, we're going to touch upon all of these impacts, from physical health to mental health to social consequences, and most importantly, what we can do to minimize harm, improve our psychological well-being, and positively rebuild. So in today's session, we're going to be talking about how to protect your health and well-being during urban wildfires and offer some actionable steps you can take. And we have a wonderful lineup of speakers today. In the second session, we'll be discussing the impacts of wildfires that are especially relevant to children and how to keep them safe both during and after wildfires. Our third session will explore the role of community support and psychological first aid to really help manage acute stress when faced with disasters such as wildfires. In our fourth webinar, we're going to cover the social impacts of wildfires, such as financial distress, housing impacts, healthcare strain, and food insecurity, and also discuss how our communities can recover. In the fifth session, we'll be focusing on the effects that wildfires have on the brain and cognition, and on resiliency efforts to protect brain health. Finally, we'll be rounding out the series with a look of the role of politics and policy in wildfires and in climate distress, with an emphasis on policies related to fire, energy, healthcare, and air quality. Throughout this series, you're going to be hearing from experts from California and throughout the US, but we're going to be prioritizing the perspectives and firsthand accounts of our LA experts who are literally living and breathing this situation in real time. A note that these webinars are being taped and links will be sent out to all who signed up, and you can find resources on our website, which we are including in the chat right now, and we hope our center will serve as a resource for both the UC community and for California more broadly during this public health crisis. Please do disseminate to others who you think may be interested. Now I'm going to turn to a long-term colleague and friend, Dr. David Eisenman, who will be moderating today's panel. Dr. Eisenman is a professor at the David Geffen School of Medicine at the UCLA Fielding School and at the UCLA Fielding School of Public Health. He's the director of the UCLA Center for Public Health and Disasters, co-director of the UCLA Center for Healthy Climate Solutions, and co-chair of research for our UC Center for Climate Health and Equity. His research is focused on public health and disasters, including wildfires, heat waves, and other effects of climate change. Welcome, David, and thank you very much.
All right, well, thank you, Sherry. You know, I too want to thank the UC Center for Climate Health and Equity for your energetic initiative and your generous support of these workshops. As you would imagine, anyone living through a disaster knows how much it means when friends and colleagues reach out and offer their help and support. And that was precisely the feelings I had when Sherry, Ariane, and their team up at UCSF called me to ask how they can help us at UCLA. So really, thank you, hats off to you. So today, we will hear about what we know and what we don't know about the health effects expected from the LA fires. It really struck me this week when several of us were in a meeting with the leadership of public health in Los Angeles, and we heard from the leadership them saying, and I'm kind of quoting here, there are not a lot of rigorous studies on all the health effects of a combined wildfire urban conflagration this size. So this is really an unprecedented event in many ways. We have a lot to learn still. We can, even with all that, provide some recommendations for staying safe and healthy, and that will be the center of today's webinar. So we have 4 speakers. They will each speak for between 7 and 10 minutes, and we will have questions and answer time, approximately 20 minutes at the end. The first speaker is Dr. Karen McKinnon, who is a professor of statistics and the environment at the University of California, Los Angeles. Her research sits at the nexus of climate change and statistics and is aimed at improving our understanding and prediction of climate extremes, variability, and change. She is a 2021 Packard Fellow in Science and Engineering, and she has served as an advisor for both city governments and private companies regarding climate change. Dr. McKinnon.
Great, thank you so much for the introduction and for the team for organizing this webinar. Thank you everyone for being here with us. Now I know that most people are here to hear about health, and we're going to get to that with the next panelist, but Sherry asked me to start us out with just providing some context about the climate and weather and environmental conditions that led to these very extreme wildfires. Like many environmental extremes, these wildfires really resulted from a confluence of multiple factors. For those of you who are in the LA area, you may remember that over the last 2 winters, we had very, very extreme precipitation. Actually, we were dealing with flooding. We had very wet, cold winters. As a result, in response to that high precipitation, we have had a lot of vegetation growth in this region. And so our plants here, they're really kind of, boom or bust with precipitation. So when it rains a lot, our plants go crazy, they get happy, they grow a lot. That kind of feels great when you're going hiking in those wet conditions. But what happened after that was one of the major causes of exacerbating these wildfires. So after these 2 wet winters, we ended up having a relatively hot summer, this most recent summer. In coastal Southern California, other colleagues at UCLA have calculated it was the 3rd hottest summer since 1895. Obviously, there's a climate change component there. I'm going to return to that at the end of my remarks. But we had all this vegetation that grew, and then we had these very, very hot, dry conditions that really dried out that vegetation over the course of the summer. And particularly things like, trees or woody vegetation that can take some time to dry out, but we had those very, very hot conditions. And then, typically in LA, we end up starting to get our winter rains, October, November, definitely December. But this year was, again, highly unusual that after those 2 wet winters, after this hot summer, we then proceeded to go into this winter effectively getting no rain. So the last time it's rained in any reasonable way was all the way back in May. And so what that means is that vegetation just continued to dry out, and there was no kind of fire stopping rain. Our conditions across the vegetation remained very, very dry. And the reason that's of particular concern is the seasonality of these high wind events that we also get in Southern California. So we get these Santa Ana winds were what are called the major kind of hot, dry winds that we get that were associated with these fires. And these winds typically start peaking again in kind of October, November, and they can happen all the way through March. But normally when those winds hit later in the winter, say in January, we've already had a bunch of rains. And so our vegetation is wetter. And so even if the winds are bringing in fire weather, you don't have a lot of dry vegetation on the ground. But this year was really problematic because, again, we were just going into the winter, and I was checking my weather app all the time saying, when are we going to see that rain on the forecast? And we just kept not seeing that rain on the forecast, got no rain. And so when these major, and these were almost record-breaking Santa Ana winds came through associated with these wildfires, that meant that you had extremely dry vegetation. You had a lot of vegetation because of those wet winters that we'd had before. And then these winds are associated with low humidity, obviously high winds, and relatively high temperatures. And all of those things together, the high temperature, the low humidity, and the high winds, that is basically the perfect fire weather ingredients. Those are the things that if you have any type of ignition, then that fire is going to spread very, very quickly. And so that was kind of the set of conditions that came together to allow these fires, once ignited, to spread very, very rapidly. Importantly, the ignition, we're, I think, almost certain that this was not kind of a lightning-caused wildfire. There wasn't lightning in the region. So certainly in this region around LA, these ignitions are all human ignitions. But then once those ignitions happen and once that heat source is there, when you add these high winds and these dry conditions, then those wildfires can just spread so quickly. And so that was kind of the context that really allowed these to be big and spread so fast, is that we had our dry vegetation, a lot of vegetation, and then very extreme fire weather conditions. The other thing I just want to briefly talk about before we move into the health implications of these fires is kind of where climate change plays into this. And in general, for climate change, the clearest signal in most cases is temperature. And so the fact that we had these hot summers that got out our vegetation, if you look at a time series of temperatures in Los Angeles, there's a clear upward trend. It certainly was related and due to climate change that we had this as our third hottest summer ever in this region. And so there's a clear climate change signal that helped dry out those fires. Dry out that vegetation leading to these fires. And also probably a little bit of a climate change signal and kind of the warmer winter temperatures that we've been having as well. The other part that climate change may play a role in, but we're a little bit less certain about, is the fact that we had this very, very delayed start to our rainy season, as well as kind of a switch from these very wet conditions to these extremely dry conditions. There is some research suggesting that this type of precipitation variability, which is sometimes called weather whiplash, is increasing in probability due to climate change. But the truth is that in Southern California, even just naturally, we live in a place that has extremely high hydroclimate variability. And so it's hard to know for sure right now if that's a climate change signal or not. But it's certainly, in terms of how climate influences us in general, is a really important thing to consider, that we kind of live in this climate where we are expected to move, between these very dry and very wet conditions. And that makes it challenging in many ways to kind of adapt and work with our environment here. So I think that's all that I have to say, just in terms of the environmental and climate context that led to these wildfires. And I look forward to hearing from the remainder of our panelists about the health implications.
Thank you, Dr. McKinnon. Our next speaker is Dr. Michael Jerrett. Dr. Jerrett is an internationally recognized expert in geographic information science for exposure assessment and spatial epidemiology. He is the Jonathan Fielding Chair in Climate Change and Public Health at the UCLA Fielding School of Public Health and the co-director of the Center for Healthy Climate Solutions. Dr. Jerrett.
Thank you, Dr. Eisenman, and I'd like to thank Sherry and her team at UCSF for organizing this very timely event. Just get my screen up for you. So I want to give you a very high-level overview of some of the exposures and health effects that emerge during and after wildfires. So I'm going to talk about some of the mental health impacts and brain impacts, what wildfire smoke is made up of, some of the biological mechanisms that we've studied extensively for other types of air pollution and less so for wildfires. Look at some of the birth outcome effects and then shift to respiratory, cardiovascular morbidity, and then finally mortality effects and emerging evidence. We have considerable evidence that wildfires can lead to a traumatic experience that increases clinically significant psychiatric effects, including depression, anxiety, and post-traumatic stress disorder. And some of that can last several years. A study done in Fort McMurray, Canada, after a large wildfire event there showed post-traumatic stress disorder up to 2 years after the initial wildfire event. We also know that children who are exposed to wildfires are more likely to develop mental illness and to perform worse in their academics. And we know that air pollution can directly affect the brain and therefore mental health. There's also an interesting phenomenon known as solastalgia. And solastalgia is when people grieve for the loss of their familiar and beloved surroundings. And Dr. Eisenman led a very interesting study that showed that people experiencing solastalgia were more likely to report clinically significant psychological distress after wildfires than those who were not. So there's something about the connection to place and the loss of those familiar surroundings that can also elicit mental health impacts. And when we look at all the possibilities, you can see that the immediate impact of wildfires is multifaceted, everything from isolation to food insecurity, school relocation, negative reminders of perhaps previous evacuations, and then changes in cerebral hemodynamics. And this is from a paper that was published in the Annual Review of Public Health that looked at environmental influences on depression. And clearly you can see there's a lot going on there. It's a very complex neurological system and with many environmental influences. But suffice to say that there's sufficient evidence now to suggest that air pollution can directly and indirectly affect brain function and contribute to depression and other mental health conditions. Now, what's in wildfire smoke? This has been a big question, particularly with the burning of structures in the sort of wildland urban interface fires that we've had here in Los Angeles. And we can see that it's a very complex toxic mixture of gases like carbon dioxide, nitrogen oxides, polycyclic aromatic hydrocarbons, volatile organic compounds, and particulate matter, especially including metals. And we saw that in Los Angeles where there was a large increase well above health protective standards in lead that occurred during and shortly after the fires. But we also have a host of so-called secondary pollutants, those that are formed as reactions, chemical reactions and physical reactions in the atmosphere after emission. So we can get additional aerosol particles, ground level ozone, and additional VOCs. And that's why during the Canadian fires that happened last year that were massive and went on for many weeks, people were smelling something that was like a burning tire. And that was the formation of aldehydes and formaldehyde, which is a group 1 carcinogen. So most of the studies that we have focused on PM 2.5 that's associated with fires. There are certainly complications to pulling out a wildfire signal, but just for those that aren't familiar with PM 2.5, it's a microscopic particle that can penetrate deeply into the lungs and affect the alveoli where the air exchange with our circulation occurs. We have a lot of evidence on urban PM, what it's composed of. We have considerably less evidence on wildfire PM. We know that sometimes we see smaller particles in the nanoparticle range, so ultrafine particles that coming from wildfires. And there have been some studies suggesting that it has oxidative and pro-inflammatory components that make it more toxic than undifferentiated PM from fossil fuel sources and other things like road dust. But the results are currently inconclusive. There's really hasn't been enough study on wildfire PM. If we look at the biological mechanisms, this is from a very nice review that Williams et al. Did last year on cardiovascular effects, but these are going to be similar for most organ systems. You can have dysregulated autonomic tone, which can lead to an increased risk for cardiac events. There's the potential for signaling that leads to a biological inflammatory response. So there's oxidative stress at the cellular level that creates a systemic inflammation that can spill over into other organ systems from the lung. And that's why we sometimes see heart and other organ systems implicated. And then we can also have PM translocate directly into the circulation when we have ultrafine particles. So those that are less than 100 nanometers in aerodynamic diameter can go directly into the bloodstream and begin delivering toxins to all organ systems and to the brain. Let me shift now to some of the empirical evidence on wildfire health effects. Let's start with the beginning of the life spectrum, birth outcomes. So this is a good study that was done by the group at Stanford. This is by Heft Neal, 2021. This just shows some of the complexities of trying to pull out the wildfire signal. So this is from a hazard mapping system that's operated by NOAA, where humans interpret smoke plumes from satellite images. And then it has to be overlaid onto PM data so that they can pull out the signal from smoke days. But what we see here is that there's evidence that there's some variability between the trimesters of exposure. But when we look at people that are living in areas with lower smoke day intensity compared to medium and high, we see an increase in the chance of preterm birth when the smoke intensity increases. And it seems as though the latter two trimesters of exposure are probably more important, but the evidence here is still inconclusive. When they examined the differences by income and race, they didn't see very much, but I thought this was interesting that if you were looking at baseline smoke quintile, so places that experience more smoke are down here, you're seeing a smaller change in the risk of preterm birth in those areas that have a lot of smoke. We don't fully understand why that's happening, but one possible explanation is that mothers who are living in these areas that experience a lot of smoke are taking evasive actions. So they're staying indoors, they're turning on their HEPA filters. They're more accustomed and acclimated to dealing with smoke than people in lower areas. When we look at the morbidity results, this is from a recent review that was published last year. We can see very strong evidence for respiratory emergency department visits, and it's similar for hospital admissions. The strongest evidence for wildfire smoke health effects is on respiratory outcomes. We see more mixed evidence on cardiovascular emergency department visits without a clear signal there. And then if we looked at hospital admissions, we'd see a slightly more positive result, but I think it's fair to conclude that the effects for cardiovascular are less certain than those for respiratory outcomes. Now, when we look at specific studies that have been done in the United States, this is for mortality. I've just highlighted in red some of those. We see some significant effects. This was a study from Washington State by Doubleday et al. So some elevation around 18% in the risk of mortality for acute exposures. We don't have any direct evidence for long-term exposures. But if we summarize that from the American studies, we can see that there's pretty good evidence for all-cause and non-accidental mortality. Respiratory, chronic lung cancer, and ischemic heart disease are much more mixed. So we don't see a clear direction of association for mortality from those causes. This is from a large study that was done in 743 cities. You can see the geographic distribution and the average pollution levels from wildfire smoke. And here we see quite convincing evidence that all-cause mortality, cardiovascular mortality, and respiratory mortality all show signals, and the lag structure shows that most of it happens on the day of the exposure or up to 2 days before. This used a chemical transport model to parse out the wildfire effect. So a little bit more precise on that, but it was a very crude assessment because the geographic scale was about 250 kilometer grid cells. Now, how big is the burden of mortality in California? This is from a study that my colleagues at UCLA and I published last year. You can see that there's a lot of variability. We did some sensitivity analysis in our exposure models, but what we see is that it's about 50,000, more than 50,000 deaths in an 11-year period. And we do the monetary estimates, it's $430 billion. So society is likely underinvesting in wildfire prevention and the response. It seems as though, a lot of the money, unfortunately, that gets given to the fire agencies that should go to prevention is being gobbled up by the excessive cost of responding to these mega wildfires. If we look at the emerging evidence, there was a very good study published last month on using the Kaiser Permanente data from Southern California. It shows about an 18% increase in the risk of incident dementia for people getting a reasonable exposure increment, 1 microgram of particulate matter. There's dermatological healthcare utilization evidence that shows atopic dermatitis and itch from San Francisco. Ocular, so irritation, inflammation of ocular surfaces, it's been well documented, but still not fully studied. And then this is a study that my former doctoral student, who's now a very successful professor at the University of Colorado Boulder, Colleen Reed, just published. And it shows that people returning to smoke damaged structures in Colorado up to 6 months later are reporting headaches and strange tastes in their mouths. So what are some of the unanswered questions here? I think, the chronic health impacts of repeated exposures to wildfires, if this is a new normal, what is it doing to our health over the long term? The evidence there is very weak. We have some evidence of the lung function and mental health impacts that I mentioned, but really we haven't done very much to study that. And the dementia study is a major step forward in that area. What's the toxicity of wildfire smoke particles compared to urban PM? Again, very understudied. What are the other impacts? What are the impacts from other constituents of wildfire smoke, like the VOCs and the ozone? We've done some studies on ozone that show there's likely an effect, but it's needs to be studied much more extensively. Who are the vulnerable populations and why? We have some ideas on that, but it's still very much an open question. What are the other health endpoints like diabetes, hypertension that we haven't studied? And how do the particles persist indoors and transform into air toxics that can affect health? And this, again, needs more study. The studies that Colleen Reed and others did in Colorado are a good start, but we need more work in that. And then finally, what are the effective public health interventions that are available? So with that, I'd like to turn it back to our panelists, and thank you for your attention today.
All right, thank you very much, Mike. So our next speaker is Dr. Gina Solomon, who is the Chief of the Division of Occupational, Environmental, and Climate Medicine at UCSF. Dr. Solomon founded and directed the Achieving Resilient Communities program at the Public Health Institute, and also served as the Deputy Secretary for Science and Health at the California Environmental Protection Agency, or California EPA. Dr. Solomon.
Great, thank you. So I am going to be talking about two issues, ash and drinking water, because there are a lot of questions coming up around both of those, especially whatever hazardous wastes may be left behind after the fire comes through, not related necessarily to the smoke, but whatever is deposited on the ground, and the issue of water contamination. So starting with the waste, there are a number of different phases that have to happen. After fire, first they have to go through, I actually didn't even include this piece, and recover bodies, look for go through with cadaver dogs. A lot of that we've been reading about in the news. As soon as that's done, the hazardous waste removal starts, which means going through, and we'll talk about what that includes. And then debris and ash removal. And then finally, soil testing before rebuilding happens. So it's a bit of a process, and all of this will unfortunately take time in the affected areas. So starting with the hazardous waste removal, what's there? Lots of stuff, everything, think of everything that could be in somebody's garage, definitely paints, chemicals of various different kinds, pesticides, car batteries, other kinds of batteries, things that contain asbestos, whether they're building materials or other things, things that are explosive, propane tanks or ammunition, electronic waste, and then if there are any industrial facilities in the area, which I think they're not really in these areas, but that can pose other concerns. And so, you see here an image of a melted battery. This is all overseen in California by the Department of Toxic Substances Control. So that's DTSC in its parlance. And they have a lot more information on their website about the whole process of hazardous waste removal. So that is to happen first before the bulk debris removal happens. And the debris is basically everything else, building materials, all kinds of stuff coated with ash. So talking about the ash a little bit, it's hazardous in that it tends to be quite alkaline. So the pH is high, can be extremely high as 11. And that is a bit corrosive, certainly corrosive to the sinuses, upper airways. If the particles that you're inhaling are small enough, it's also corrosive and damaging to the lower airways. It also contains basically soot, carbon black, PAHs. Dr. Jerrett spoke a bit about those. So these are hydrocarbons, some of which are carcinogenic, and heavy metals of a variety of kinds, some of which are not particularly toxic, others very toxic. And then there are traces of other chemicals that are created from burning and other stuff, microplastics, asbestos fibers, etc. So it's a mix. Interestingly, since the Santa Ana winds were driving these fires, a lot of stuff blew offshore. I don't know if that's a good thing or a bad thing, but Scripps San Diego research vessel that was offshore ended up using the opportunity to collect samples of ash that were landing on the ocean. And I think that's going to be really interesting to see what the analysis shows. So basically, each burned home will generate about 15 truckloads of debris. So there's just an enormous amount of truck traffic that is going to be happening during this cleanup. The debris is usually either what they call burrito wrapped or else tarped, and it's therefore should not be itself contaminating the neighborhoods, but the trucks are diesel and they're going to be going through the streets. Then there are a couple options, whether you elect to have the government clean up your or remove the debris, or whether the homeowner decides to do it themselves. If the homeowner starts moving things around, then it kind of becomes their responsibility. And there's the personal protective equipment. And shoes and onto your skin. It's a different agency that runs the debris and ash cleanup, Cal Recycle, and that is their website is here, and there's information about their cleanup here. And the South Coast Air Quality Management District also has a role here in terms of trying to make sure that people aren't sending that ash flying up into the air and ending up with it further contaminating areas. And so, among other things, they sort of bury it down in the lower left. They say, don't use leaf blowers. That's a really important message here with the ash, because that just sends it, anything that sends it up into the air is a bad thing. Let's pivot to water contamination. Basically, a couple issues happen after fires. One is that there tends to be sediment contamination, which can include microbial contamination. So that could be handled with a boil water advisory. But there's a worse kind of contamination that also can occur, which is with VOCs, these volatile organic compounds that Dr. Jerrett mentioned. The most important of which is benzene, especially because it's a known human carcinogen and is of concern even at fairly low concentrations. And the reason that that happens is because of smoke getting into the water system where it really does not belong. And this first happened in 2017 in a small neighborhood in Santa Rosa after the Tubbs fire. Only 13 homes survived in that neighborhood, but when people went back to those homes, turned on their taps, they noticed the water smelled like gasoline. And that was the first indication that there was something really weird going on. It affected a much larger area after the 2018 Camp Fire, and I did some studies in that area. And what we found was that the concentrations of benzene within the water system mostly were fairly low, but that there were these, some unfortunate neighborhoods and homes that had extremely high concentrations of benzene, up to 100 times higher than the allowable, the so-called maximum contaminant level that's allowed in water. That's a big concern, and you can see it was mostly in these SSs. SS stands for, it was the code for service connections. So these are basically the very small water lines that go from the water main in the street to a home. And those were the most contaminated and are the things that need to be checked most carefully after these LA fires. We also looked at timing. The Camp Fire happened in November of 2018. And you can see here that you're still seeing, there was still some benzene contamination as late as March of 2020. But that really most of the contamination was within the first 6 months or so, up until about June of 2019, where they were still finding quite a few contaminated areas of the water system. So the first 6 months is going to be the time when we really are going to have the worst issues with water contamination. We also did some testing of what chemicals, looking at many hundreds of chemicals in water supply samples, and also doing some tests with burning and melting of pipes in partnership with the California Department of Public Health Laboratory. And turns out that there were chemicals associated with different kinds of plastics, some of which are in pipes. So those pipes may have been burning or melting. And others were just associated with burning of biomass or burning of things like tires and other kinds of waste. And when those get sucked backwards, remember some of the fire hydrants went dry. That means that air was getting sucked into the water system. When that happens, those contaminants get into places where they shouldn't be, and they can linger there for some period of time. The only way to deal with that is flushing the system or even replacing sections of highly contaminated pipe. So my final recommendations, if you're in an area with a drinking water advisory, for now, until the testing results come back, don't drink the water, don't use it for cooking, avoid skin contact, avoid breathing in steam. But once the data come back, that advisory may be lifted. And if it's lifted, then it's going to be because they have found no contaminants and it's safe to drink the water. But if it's not lifted, you could be in for a long haul as they try to get the issue cleaned up. If you're outside the area with drinking water advisories, the water is okay. It's an area of the system. It did not lose pressure, so you can presume that that the water is okay in your area. So just want to hand it on now to Dr. Thakur, who will talk more about air quality.
Thank you, Dr. Solomon. Yes, next is Dr. Neeta Thakur, who is a pulmonary and critical care physician at UCSF and the medical director of the chest clinic at Zuckerberg San Francisco General Hospital. She's director of the Prize Center at UCSF and is also co-chair of research for the UC Center for Climate, Health, and Equity. Dr. Thakur.
Thank you, Dr. Eisenman. I will be sharing some practical tips for reducing the health impacts, particularly from wildfire smoke. Thank you, Dr. Solomon, for walking us through some of the prevention tips for other contaminants that the LA community has been experiencing due to the wildfires. So specifically, I'll be talking about the air quality index. It's the most commonly used index for public health guidance and to share real-time information about what the air quality is like, and specifically talk a little bit about the nuances of it and how it can be useful. And then talk a little bit more about what has been demonstrated to work to reduce the health impacts that you heard about from Dr. Jerrett around wildfire smoke, and then what to be sharing with patients and communities around these preventative tips. And so using the air quality index, this is an index to share real-time information about the air quality. It's based on fine particulate matter, or PM 2.5 levels. And so it doesn't include other air toxins that might be in the air that you heard about earlier in this webinar, which can be one of the cons in interpreting the AQI. It also uses cutoffs that are color-coded that are linked to really try to provide guidance to different groups that might be susceptible to poor air quality and also to different health outcomes. This color scaling allows it to be a little bit easier to use when talking with different groups and populations about what the air quality is like at that moment. Some of the limitations, as mentioned earlier, it's really only based on fine particulate matter levels. But one thing we do know, as smoke ages, some of those VOCs and other chemicals that are in the air do bind to PM 2.5, and so it can be relatively accurate in stating what the air quality is. So maybe not the greatest when there's an active burning fire, but when there's a smoldering fire and it's been several days or aging of smoke, the levels can be more accurate of what the air quality is. And also just to know that air quality is a continuous variable. And so the AQI incorporates cutoffs, but know that like if the air quality is around those cutoffs, you really need to be incorporating all of the information about yourself and your own sensitivities and making informed decisions about whether going outside or needing a face mask when going out. So just to know that the cutoffs are there to provide some help, but they're not. They are somewhat arbitrary. These are some of the resources that I used personally and also share with my patients about thinking about how to find out more information about the air quality. Air Now has a nice website that incorporates the low-cost sensor data with the fireairnow.gov website, where you can see what your neighborhood specifically is showing. IQ Air is a little bit more easy to understand and usable. Like my parents like to use that because it's very user-friendly as an application. And then Watch Duty has really been a great resource, particularly in finding out about fires that are happening nearby, and also evacuation alerts, since it's a volunteer-based system that is actively listening to what is going on the radios and taking what they're hearing from CAL FIRE and trying to transmit it out to all of those that might be impacted to get evacuation alerts earlier as a communication method. And then one other that I have used personally and also recommend in thinking about planning is a smoke spotter for California that provides some smoke forecasting and incorporates some of the weather information to be able to maybe plan a little bit about maybe when to do certain activities outside versus not outside based on what the smoke forecast looks like. And now just to shift a little bit more in thinking about prevention mechanisms, I think about like what should we do before the fire occurs or before the wildfire smoke event occurs, and think about emergency planning. Unfortunately, as we've been hearing, with the changing climate, we are seeing more fires happening in the state of California and across the Pacific Northwest. And so we need to start planning so that we can be more resilient and have better emergency plans during the time of fire or wildfire smoke events. I'll spend a little bit time of talking about mask, air filtration, and then also creating a clean space. And so for emergency planning, we kind of think about it in the emergency response world as like pre-disasters, during, and then recovery. And so thinking about that for yourself and also for your community. So pre-disaster, being prepared. So ensuring that you have an emergency plan set up with your family and with your community, ensuring that you have supplies. So here on the slide, I put an example of what might go in what we call a go bag. It's really important of thinking not just about immediate items, but thinking about if you have medications, ensuring that you always have at least a 2-week supply on hand. Thinking about if you use durable medical equipment that you have that requires charging, that you have that materials available to be able to place in such a bag and have it ready. And then also thinking about efforts of how do you buttress your home. So there's a lot of discussion about trying to thinking about fire resistant materials, but also thinking about your central air filtration, or even placing one in to make it be a better fortified place to protect it from both fire, but also from infiltration of the wildfire smoke from outside into your home. And then on a community level, ensuring there is good risk communication going on and knowing what type of surveillance and monitoring is happening in your community. So when there is an event, you know where to go for information so that you're kept up to date. And so during disaster, this risk communication is going to be really important. It's also important to re-review plans with everybody that you are working with and also are living with, and having your go bag. And then remembering, if you are evacuating your house, there are some things that you can do to safeguard your home. CAL FIRE has a list of those things. It's like turning off your gas, thinking about closing your vents. So things like that to try to reduce potentially the harm from your house from the aftermaths. And then after the event, it's always important to learn from that disaster, both on a community and individual level, and thinking about how to support the community further in the next time that it happens. Now, I'm going to speak a little bit about face masks. And so I would say face masks are a tool to reduce your risk from wildfire smoke. We know that from the information shared by Dr. Jerrett, that wildfire smoke has a lot of health impacts, both from the breathing, the heart, with preterm birth and mortality. And face masks can be a way to reduce your exposure risk. But don't think of them as the thing that's going to completely eliminate your risk. And so, if you have to be outside, they are a good tool to use. And it's really important to use the right type of mask. And we did a survey in San Francisco, and while 75% of people reported using face masks during wildfire smoke days here in San Francisco, only about 47% of them were actually, about 47% of them were actually using a cloth face mask, and only a few percentage were using the right type of mask. So thinking of the high quality N95, KN95, or even on very intense smoke days, if you're not able to stay inside, which is the #1 recommendation, actually going for one of the respirators that will decrease the exposure to PM 2.5. And what it's important to stress is that it doesn't reduce exposure to all air pollutants or gases. And so these masks are really focusing on is reducing your risk of exposure to fine particulate matter. And we think they may mitigate short-term impacts. We don't have long-term studies, or we don't have studies yet to really show how they're preventing health impacts. So we think they're good, and we do recommend them. But we also acknowledge that staying indoors and just reducing your overall exposure is probably the most important thing for reducing exposure risk. And then thinking about inside the home, there are a number of ways of thinking about air filtration. One is thinking about portable devices, and the second is thinking about central. With portable devices, we're really thinking about cleaning the room, while with central, like HVAC systems, we're really thinking about cleaning the building, and the type of filter matters in both cases. And here we're really thinking about those filters that have a MERV rating of greater than 13 to remove the smoke particles, and knowing that HEPA filters are MERV 16. So this is just some information about knowing the different types and really looking for these higher rating numbers to reduce the infiltration of these. And this study just showed that if you use a HEPA filter, you're going to be reducing your indoor exposure by 30 to 80%. And this is both with, and it also shows that especially for central devices, central systems, you're reducing the indoor penetration into the house. We also know that DIY box fans are effective at reducing wildfire smoke. There's some instructions here available through the Washington State website that's available both in English and Spanish. These less expensive, easy to make boxes can really significantly reduce your exposure inside the home as well. And then the last thing I will touch on is thinking about how to create a clean space indoors. And so we talked about air filtration. And if you're inside, making sure that you're keeping your windows and doors closed. This time of the year, it's cooler, so it's a little bit easier. But when there's extreme heat days and wildfire smoke days, this can be harder, but keeping the doors and windows closed is really important. Reducing activities that increase pollution inside and keeping the room clean. So wiping down surfaces, but not trying to vacuum during the smoke event because that can upring. And there's some more information through this fact sheet from the EPA on how to create a clean space. And the last thing I'll touch in is that has come up is making sure that the air is not being recycled from outside. So what does that mean? It means if you have an HVAC system, really setting it to recirculate and close the outdoor intake damper. And then for air conditions, thinking about the inflow-outflow track and ensuring that there's a two-hose system as opposed to a one-hose system. And I will give it back to David to take us through some questions as a panel.
Okay. All right. Thank you very much, Dr. Thakur. Two questions that pop up to me. One, I'm going to ask Dr. Solomon to turn on her camera. And this is a question that moderator's prerogative, but I know is interesting to people and will be. As the communities, people start re-entering their communities, there will be debris in their neighbors' yards and being trucked out. And even if their home is fine, they may be living among a lot of toxic debris. What do we know about the long-term health effects of having that debris in your neighborhood? Even if, say, the water has been allowed to be drank, what can we say about its contamination or getting through the air?
Yeah, there's a lot of concern about this issue. I see Dr. Jerrett also may have something to say on this. It's a lot of questions about it, and not, unfortunately, a lot of science yet on this issue of ash and debris and exactly what the health risks are. There are well-known ways to mitigate those risks. For example, wetting down the debris piles and the ash before removing it, and then making sure that it's encapsulated. In other words, tarped with plastic and so forth to keep it from blowing around when it's being trucked away. But there if you're in a, one of those people who is in a home that's on kind of an island surrounded by burned properties, there are going to be some hazards there. I think that will be rarer than people who are in neighborhoods that are sort of adjacent to burn zones, where the risk will be less. And in some ways, I worry almost more about all the truck traffic than about the debris.
You want to expand on the truck traffic? That's also
Just that, these are a lot of diesel vehicles running through neighborhoods. And diesel, we know a fair amount about diesel exhaust, and although diesel is not, there is lower emitting than it used to be, it does still emit quite a lot of fine particulate matter. And so the ash is larger particles, tends to affect the skin, upper airways, sinuses. The diesel exhaust and the small smoke particles are similar in some regards, in that they penetrate deeper into the lungs.
Thank you. I'm going to turn this next question over to Neeta. You talked about closing your vents. Should people also be thinking, even if they have central AC, about having in-room filters? Is there any added protection?
I think the most important thing for the central systems is to ensure that you have the right filter in place. And so if you're not sure, or it hasn't been changed in a while, there is then the added benefit of providing an air purifier. For populations that have sensitivities to poor air quality, particularly wildfire smoke, considering putting an additional air purifier in where you sleep, since you spend a large amount of time in that room, can provide a little bit of extra assurance that that room stays clean during the night. So it's really ensuring that your filters are changed and that you have the right filter type.
Great, thank you.
I think just to add something that I think is important on the indoor air, and I totally agree with Dr. Solomon that we don't know enough about this yet, but there is an industrial hygiene manual by the American Industrial Hygiene Association for what you should do to remediate afterwards. And if you're in one of those homes that's left standing, which has almost certainly had huge smoke exposure, it's important to have a registered industrial hygienist come and inspect the area for you, because oftentimes it's not going to be visible to the naked eye, but there could be contaminants that can persist for months after the fire and cause illness. So that's what I would recommend. And this might be a battle with insurance companies, because they don't always want to, pay for somebody that's qualified, but that's another step that you can take as a homeowner.
Thank you. I'm going to turn it over now to Dr. Weiser, Sherry Weiser, to usher us out.
Yes. Well, first of all, thank you to our wonderful speakers and moderator for really excellent insights. And thank you to everyone for attending. I just wanted to alert you all to another event that we're hosting tonight from 5 to 7 p.m., led by our UC-wide Mental Health Council. We're sponsoring a 2-hour psychoeducational training facilitated by disaster mental health experts from the nonprofit Vibrant Emotional Health tonight. And this session will provide basic skills to effectively help those impacted by wildfires with acute stress responses that Mike talked about, and is really intended for mental health and healthcare clinicians who either want to help in LA now or want to be prepared to assist in the future. We're sending out the link to register in the chat right now. And as I close out, I also wanted to remind you to sign up for our next webinar, which will be held at the same time next week. The registration link we're also going to chat out. It's entitled Crisis Response for Kids, Keeping Children Safe During and After Wildfires, which will be moderated by Dr. Dick Jackson from UCLA. Thank you all very much for your time. And again, thanks to the wonderful speakers.